Hello, my friends and my viewers. How are you all? I hope you are all in good health and taking some inspiration from the various updates, information on various social media, from books, from the you can say the newspapers and all. We have a lot of material. We have a lot of information regarding health. The main thing is how you incorporate that information for your benefit. It's not that every information will be useful for every person. It differs from person to person, the choices of the person, the lifestyle of the person, the economic capability of that person. Many things are there, but nothing is going to hinder if you actually determine that you are going to work on that, on your health options, on your eating habits. And that is very very simple to adopt also. Things have been made much complicated by the so-called dietitians, nutritionists and all, many such which are not actually having information regarding how the food is being processed or metabolized in our body. So the understanding of biochemistry is very important, that how when you eat carbohydrates, proteins and fat, they are metabolized or they are processed in the body, and how they work in the body to provide energy. And I would say I'm definitely against this calorie concept, because this has never been able to you can say affirm that. I couldn't actually believe that how can we stick to some calorie counts and then say that this much calories should be given and that much should not be taken, and this much grams of carbohydrate, this much grams of protein, that grams of fats and all. So I'm not at all a calorie person. So I'm not going to tell you to count your calories. What I want to say is that just eat that food which is real, that is you're cooking at your home, and it should contain normal ingredients which are used in the household kitchens from the ancestral era, and just eat as per your hunger, and don't actually deprive your body or your mind, your soul of anything which you have been eating since long. Okay, main problem is deprivation. What happens is when a person starts gaining weight, when a person has some chronic illness, say diabetes, they are told to deprive many things. That deprivation, that sense that when a person has an illness, that the person gets scared, gets anxious, that now I will be told to abstain from many things. So that thinking in the mind, that psychological disturbance actually is more dominant in that sick person, rather than the body processes which are going aberrant or becoming abnormal. So I would say that we cannot say that the diabetic person should be told that you eat whatever sugar you're eating and all. Yes, but you can incorporate some healthy sugars, that healthy carbs which can satiate the person, the diabetic person, or satisfy the needs or the hunger of that person, the craving of that person, so that they don't feel that lacuna, that they have been deprived of something. Okay, for example, you can just say that you incorporate more of fibers, eat raw fruits. If you like eating something sweet, you can grab some dates, you can add some jaggery. And if the person is eating clean and eating home cooked high fiber diet, and you can say healthy nutritious food, then those healthy carbs are not going to harm that diabetic person also. Okay, most important is that the person has to be calm, has to be psychologically stable, and has to not think of that diabetes or any chronic illness is taking away years of his life, is inhibiting him to do something. Okay, so nowadays it's very important to tackle a person with chronic illness, a person with common such issues like diabetic problems or cardiovascular problems. Deal with them from their mental makeup, from their psychological, you can say, mindset. Okay, it's not only mechanical that you give these drugs, you monitor their sugar, you call them from for the health checkups and all. We cannot deal with a patient like a machine, or just try that they follow what we say every day. The mental makeup is very important. So I would say that please recommend such kind of diets to people who are sick or who are suffering from any kind of you can say substrate overloads. I like in diabetes is glucose overload, or in fatty liver there is fat overload. So there are certain diseases where there is overload of certain substrates. So it's not that the substrates are cut down, it's basically glucose is increasing in diabetes not because you are eating more glucose, it's the metabolism which is actually aberrant, or the problem in the metabolism that is leading to hyperglycemia. And the major problem is because the person is becoming insulin resistant, the insulin is not working, so the glucose is not being controlled. Okay, after that comes the step that we say that you please avoid sugary foods, added sugar, processed food, because that will add up to more glucose in the circulation and increase the hyperglycemia. Okay, initially the person doesn't become hyperglycemic because of taking more of glucose, but because of problem in the metabolism of glucose due to insulin resistance. And thus insulin resistance can precipitate from various risk factors, which can be obesity, which can be problem in the lipids, which can be due to the fatty liver, which can cause the pancreatic stimulation and more of insulin to be released, which can be due to more of visceral fat. It can be anything, if there is problem in the mitochondrial metabolism also at various levels, when the tissues become resistant to insulin. It can be problem in the insulin signaling mechanism. It can be the genetics of the person, epigenetics of the person, which can then convert into full-blown diabetes if the person is pre-diabetic or genetically, you can say, inclined to have diabetes. So that can alter the phenotype of that person. So there are many factors. If a person is actually having a sedentary lifestyle, has some addictions like smoking, alcohol intake, has a lot of stress, has a lot of hypertension, many things cause disturbance in the body. And the major underlying factor is increased free radical stress in the body because of various problems occurring in the body due to risk factors. That is going to cause inflammation, that is going to damage the organs, and that is also a factor which causes insulin resistance. Okay, so if you make your patients understand the underlying problem, they will better understand that also in a very simple language. I will not say that you go into metabolism deep down and then the person might get confused, but just try to make them understand what is the problem, what are the risk factors they are facing. And each individual will be having different risk factors. We have to make them aware of those risk factors and deal with those risk factors person to person, individual to individual. Try individualistically, you can say, oriented or patient-centric kind of intervention, and treat every individual, although with the same disease, in their own way. That is, what are their factors which can actually interfere in this problem which they are actually suffering with. Okay, so I would say that all can be healthy if they have a healthy approach in their life, both mentally and physically. So increase your mental strength, also increase your physical strength, also be mentally strong even if you have a disease, because diseases are very much in our control. We are not in their control. We can control them if we are mentally strong and we are determined to control them. Okay, you have to just do one thing, that is eat home cooked clean food, abstain from added sugar, processed food, fast foods, and see the magic. Stop binge eating, try to control yourself, drink a lot of water, fluids, eat a lot of fiber, and remain calm, meditate, breathe, and try to just make out time for yourself also in a day, and appreciate your space and time with yourself. Do what you feel like doing happily in your space, only with yourself. So just find out time for that. That's very important to remain healthy. Bye.